Okay. Well, super. It's my pleasure to introduce you all to Hayley Hutchison from George Mason University. So take it away, Hayley.
Hello. Morning, good afternoon, good evening to all of you watching. By the way, that's the usual greeting you may hear if you work in the global health space and connect with people across different time zones. My name is Hayley Hutchison from the Gamma Tau chapter through George Mason University. Today, I want to talk about global health advocacy and communications, mainly through some anecdotal examples from my work supporting the Global Fund to fight AIDS, tuberculosis, and malaria. So, just a little brief about me. I've had the opportunity to work in the nonprofit and public sector spaces for both health and science work. Currently, I run my own communications and design consultancy, doing communications work for some small nonprofits. And before that, I worked as a communications specialist at the National Institute of Allergy and Infectious Diseases at the National Institutes of Health and at a Japanese nonprofit supporting global health initiatives. Over 10 years ago, I was also an English teacher in Japan through the Japan Exchange and Teaching Program. Today, I want to talk about my experience supporting the Global Fund to fight AIDS, tuberculosis, and malaria, or the Global Fund. I'll talk about the Global Fund, its key advocacy partners. I'm going to compare different communication strategies that were implemented ahead of a key funding milestone, discuss the work I did for Japanese partners more in depth, and how all of that advocacy panned out. A lot has changed in the global health and global health advocacy space since I was working in the field back in 2024. But I hope that by sharing these experiences, you'll find some useful insights for your own work in health communications and beyond. So, even as the global health space evolves, effective communication comes down to understanding culture, language, context, and purpose. How you deliver a message, who are you delivering it to, and why it matters. Advocacy strategy goes hand in hand with policy and people and is crafted through clear messaging, targeted outreach, public support, media engagement, regular monitoring and evaluation, and ability to adapt to crises like the COVID-19 pandemic. All this to disseminate messages to influence policy change. Another core idea in global health advocacy is resource mobilization, which, as it sounds, is mobilizing the resources, both financial and non-financial, to ensure an organization can achieve its mission. For example, instead of only using their own money for taking out ads, organizations can utilize social impact initiatives, civil society community networks, the media, and others to help fundraise more than they could ever do alone. Now, to show you how some of these concepts play out in practice, I want to take you back to 2022 when I was doing communications for supporting the Global Fund. Now, our main player in the story is the Global Fund. The Global Fund is an international, multilateral, nonpartisan financing mechanism that is supported by government and private sector funding. Since 2002, the Global Fund has been able to invest up to $5 billion a year to fight HIV, TB, and malaria in more than 100 countries. To do this, it fundraises every 3 years in a moment called a replenishment. Governments, philanthropists, and civil society and private sector organizations pledge funding each replenishment to continue the support of the Global Fund and ensure its stability, and that countries can get funding for programs like TB clinics and HIV medication and mosquito netting. But how do you get the same groups to pledge more every 3 years? Through resource mobilization and targeted advocacy campaigns. The Global Fund does not do its advocacy alone. It has the help of many civil society organizations, including Friends of the Global Fund groups. These include Friends of the Global Fund Europe, representing Europe, Friends of the Global Fight, representing the US, Friends of the Global Fund Japan, and Pacific Friends of the Global Fund. I'm going to focus on Friends US, Friends Europe, and Friends Japan communications today. All of these players, in addition to many other civil society organizations and supportive groups, played a huge role in resource mobilization ahead of Global Fund's seventh replenishment in 2022. But while their goals were the same, the methods in which they did their advocacy communication campaigns differed in noticeable ways. Here, you may be able to see real-world application of what you've learned about culturally competent communications. And I hope from these stories, you can come out with a strong appreciation for the effort from multiple fronts that goes into supporting different global health initiatives. First, let me show you the Global Fund's own advocacy leading up to the seventh replenishment. You see here data in percentages, positive messaging, and calls to action. If it's not positive, it's neutral. Why? The messaging here is going to everyone. It's the Global Fund. Politician, layperson, community health worker, all around the world. If the Global Fund itself uses too much negative messaging, especially pointing at countries or demanding money, it may risk alienating potential donors and potential funding. So let's look at the strategy of Friends of the Global Fund Europe. Their strategy focused on bolstering the combined EU member state response rather than just targeting on heavy hitters like Germany or France. They also focused on multilateralism and the topics of health system strengthening, which was important to Europe's global health agenda. Some methods they implemented included advertisements in local newspapers. The one I have up here is for World Malaria Day in a French newspaper. It says, World Malaria Day. Every minute, one child under 5 years old dies from malaria. Mr. President, increase the contribution to the Global Fund to fight AIDS, tuberculosis, and malaria. Other methods included sending greeting cards to main stakeholders and having webinars and events inviting policymakers. They also focus on interparliamentary communications, such as the EU or the UK and US policymakers. This included writing letters between GOP members and Tories. The idea here was to craft a narrative around intergovernmental communications that the US would not be left to overcompensate for donations to the Global Fund and to alleviate worries of burden sharing. You can see here how some of these resources we talked about, digital media, communications, one-on-one interaction, business, government, are all being tapped into for this advocacy. And there are also some social media posts, which I will show on the next slide. You can see here some of the social media posts that Friends Europe used. It's a little different than the global funds, right? You see here more direct, almost accusatory messaging in a lot of these. You can also see the focus on the bottom right image on a kind of return on investment for the EU to pledge to the Global Fund. These messages are meant to pressure policymakers directly, but also stir up feelings in the population um, to get their policymakers to act. Ultimately, Friends Europe mainly focused their communication strategy offline with meetings, events, and publications, like the newspaper article in the previous slide. So going on to our Friends US colleagues, they also focus a great deal in their communication strategy on direct policymaker involvement. And they focus their messaging on unilateralism, which, as you notice, is different than EU advocacy focusing on multilateralism. And similar to some EU communications, they focus on return for investment for the United States. Some methods of doing this included, of course, meetings with policymakers, but they also did a digital ad series focusing on education for new congressional members and staff. In addition, they organized letters from faith leaders, business leaders, celebrities, and others directed to politicians ahead of the Global Fund replenishment. The Friends US goal was to convince the US government to pledge high and early and to convince other countries to follow their lead. You also see here events and interparliamentary communications similar to the European strategy. And the infographic here talking about return on investment is very data heavy and focused on funding and numbers, which is more targeted to policymakers. Once again, let's look at some of digital media their digital media communications. Here you can see some other messaging. They did not focus as much of their own social media communications. They did share partner communications and official Global Fund communications on social media, but their primary communication products were higher level, dataful infographics, issue briefs, some of which are shared on social media, but some were shared more directly. They also focused messaging on persuading other countries like Canada to step up, as shown in the image on the right, which says Canada should increase its commitment to the Global Fund by 30% alongside other donors. Every 100 million Canadian dollars short of this goal will leave 50 million Canadian dollars on the table. The US has pledged $6 billion, but its contributions must be matched 2 to 1 to unlock total funding. So I want to move on to the Japanese advocacy. So I worked supporting Friends of the Global Fund Japan. So I have a deeper insight into the logic and theory behind this group's communications. Namely, we wanted to spread awareness of the Global Fund, not just to policymakers, but also to influencers and to what we called socially conscious members of the public, or people who care about health and the environment. So to do this, we focus our communication strategy on talking about return on investment for Japan. What has or will Japan's contribution materialize as? What does it translate to tangibly on the ground? We also wanted to communicate why Japan, which has fewer cases of HIV and TB than many other countries in the world, and almost none of malaria, should care about these diseases. We also wanted to bring the messaging back to Japan's global health strategy, which has for many years focused on supporting countries adopting universal health coverage. So some of the methods to do this included one-to-one policymaker lobbying, which we've seen for the other groups as well, news articles, including policymakers and events, and so on. Friends Japan also did a large number of videos ahead of the replenishment, including a documentary showing site visits to affected countries and how the Global Fund has helped, a YouTube influencer video series, and infographic videos. These videos helps to tell human stories, which resonate very strongly with Japanese audiences, especially when framed around progress. So showing some of the social media posts we made ahead of the seventh replenishment, you can see here they're a little bit different than our Friends US and Friends Europe colleagues. For the Japanese context, being direct or confrontational, like our Friends Europe colleagues, would not have been effective communication. Our strategy focused on gently building policymaker awareness that there is indeed public support for the Global Fund, that its work matters for Japan and the world. To do that, we designed an advocacy communications campaign that targeted policymakers, influencers, and socially conscious members of the public separately and collectively. Japan has been a top donor since the Global Fund's inception, so the messaging needed to encourage Japan to step up as a donor, but in a way that felt supportive rather than pushy. So instead of calling Japan out, we would highlight how other countries are stepping up, creating a little bit of positive peer pressure. We also emphasize appreciation from implementing countries and from other donors to Japan through positive and also through positive, hopeful human stories like our documentary series and others, in order to show the direct impact of the Global Fund and Japan's role in it. You can see a big focus here on positive, affirming messaging, which is a core part of our communication strategy. Here's a brochure I worked on for Friends Japan that was a printable handout for policymakers at events. Here you can see I'm describing the origin of the Global Fund, why tackling AIDS, TB, and malaria matters to Japan, I included here the number of cases of these diseases in Japan, as well as circling in the Sustainable Development Goals of healthy lives and well-being for all, as SDGs are very important to Japan's global health agenda. I also show the financing support from Japan, how it's been a key donor since the Global Fund's inception, and discuss how that funding has helped. So I want to go into a little bit of the stepwise method for our advocacy communications. For socially conscious members of the public, we use targeted messaging on social media to encourage engagement and provided educational opportunities through our YouTube series and documentary. These individuals influence influencers and policymakers. The influencers, which included journalists, commentators, TV personalities, and business people, were those with knowledge of global health or those who are socially conscious and willing to learn. For them, we had education opportunities such as through the documentary, custom social media messaging, and engagement opportunities. We involved them in our YouTube video series that included policymakers. And then the policymakers themselves. We sought out policymakers who already supported the Global Fund and who would have the greatest impact. We would also educate new policymakers through one-to-one meetings and videos and included them in events and in our YouTube series. This was all with the goal to create communication content to bridge the knowledge gap between these sets of people and increase awareness about the Global Fund and ultimately drive policy change. I want to briefly show an advocacy strategy framework that helped inform some of our communications efforts. This framework is structured around the theory of change. As mentioned, we tried to target our three audiences, which are shown in the framework on the x-axis. The changes we hoped for were to increase awareness of the Global Fund, where it's ultimately the action of policy change and increased funding. To give an example, a lot of policymakers and influencers may not know about infectious diseases, but many members of the public, they might, but policymakers and influencers may also already know about infectious diseases. So education is key here in that messaging to drive to increase awareness. Then increase members of the public will to be involved, and then their drive to mobilize the community or to push for policy change. Each audience affected the next, so some messaging was targeted, but could also be slightly broad to reach each of them in impactful ways. Members of the public may feel strongly about a documentary showing malaria, and they talk about it on social media or reach out to policymakers to do something about it. Influencers, with their large social media following, could spread messages and drive change by interacting with policymakers in our YouTube series, that's also seen by members of the public. For each of our different communications materials, we sought to build awareness of the Global Fund, what it does, and how the audience can help. From this, we created a strong communications campaign that ultimately had equally strong impact. So in September 2022, the Global Fund held its 7th replenishment during the UN General Assembly week in New York. You can see some of the major players here: Prime Minister Kishida, President Biden, President Macron, European Commissioner President von der Leyen, and Bill Gates from the Bill and Melinda Gates Foundation. This milestone event was a major success. Overall pledges increased by 12% from the last replenishment, and Japan's contribution rose by 30% from their previous replenishment cycle. Here it's just showing the country's support by how much they're contributing to the whole pot. That funding will support efforts to tackle AIDS, TB, and malaria in countries that need it most. And of course, no single partner can take the full credit for a result like this. But the advocacy work done by the Friends of the Global Fund partners played a meaningful role, mobilizing resources, delivering culturally competent advocacy, and shaping messages that resonate with target audiences. All of these pieces contributed to a successful outcome. And ultimately, that's the heart of public and global health. Our contribution, whether big or small, whether financial or not, can create a ripple effect to save lives for years to come. So thank you all for listening today. I hope this was insightful. Feel free to connect with me on LinkedIn, and I look forward to our discussion later. So now I'm going to stop sharing my screen so that we can go to my co-presenter, Nisha.
Thank you, Haley. That was an interesting presentation. I will begin sharing my screen. Just So, good morning, everyone. Good afternoon. Today, I will be presenting about advocacy through evidence in public health. A little bit about me. I am Nagashree R Rao, and I go by Nisha. I completed my first master's degree in biostatistics, and I'm a recent graduate from University of South Florida, where I earned my public health degree. And without further ado, I'm just going to begin with the presentation. Today, my agenda is to talk about why evidence matters and how we can turn these evidences or stories into data, and how these data can be turned into actionable insights, and also to follow up with a real world example and give you practical lessons for public health professionals on advocacy. And finally, we'll have questions and discussions to wrap up. So you might be wondering why or how this connects to public health in general. But the thing is, public health isn't just about diseases. It's about understanding people, identifying the barriers, and using evidence to improve outcomes. So today I'm going to use an example that happens to be about small liberal arts college students. So the first slide I'm talking about is why evidence matters. And when people hear about advocacy in general, they think about policy, lobbying, or speaking to lawmakers. But in public health, advocacy usually starts much earlier. It starts with just listening and just listening to what people have to say. So every data set we work with represents real people and their real experiences and challenges that they face in their daily lives. And our role is to take those experiences and organize them into evidence and then communicate them in such a way that those evidence can lead to an action. And so today I am walking you through an example from my own work at the Small Liberal Arts College in rural Arkansas that shows how a mixed methods approach using both quantitative and qualitative data can work together to support the decision making. So turning stories into data. So one of the projects that I worked on it's a pilot project that I worked on as I started my work here at Lyon College in Arkansas. So as somebody from my role as an academic data specialist who was hired to look at student retention and student success, my work was to work with student data. So I predominantly just analyze student records and since the time they apply to their matriculation to till the time they graduate. So so in order to understand the student experience at Lyon College, we conducted six focus groups with 16 students representing different backgrounds, including some of the domestic students, international students, first year students, transfers, and student athletes. And the way the students were selected was to actually have a smaller representation of the student demographics of the whole population of the Lyon College. So we had 16 students and we sat with them to just understand their experiences. So some of the questionnaires were designed, and there were student workers that were hired to facilitate these focus groups, and they were trained with qualitative research methods, and we got some interesting insights into what their student experience were like at Lyon College. And as researchers, we always hear stories all the time, but the challenge was actually from moving from just interesting conversations to something systematic and actionable. So having the training in the qualitative methods along with these student workers kind of helped streamline and get some actionable data. So once we had all of these, once we had the conversation, we got some information. those were recorded, and these recorded transcripts were like then imported to our software and coded, and we coded the responses into themes and created a structured data set of approximately 680 coded statements. And the goal was not to count the complaints, but it was to understand what student experiences were like and what they were trying to tell us here about their experience at the college. So the next slide, turning themes into evidence. So right, like what the student told us was like several themes emerged repeatedly, and students talked about academic adjustments, financial pressures, social belongings, athletic housing conditions, and just general well-being. Now the social, well, like because of the quantitative data analysis that I did before the qualitative study, it was pretty clear about some of the risk factors, and these were obvious risk factors that we had identified, because coming from a small rural liberal arts college, financial pressures doesn't shock you as a risk factor. But at the same time, I think we also saw first generation being risk factors for, or being significantly standing out, because first generation students happen to have no prior information or no clarity on like what they need to do, since they are first generation graduate students, undergraduate students. So, but turns out when we did the qualitative study, we saw that there was more resilience and perseverance among the first generation students. So that did not really emerge as a theme or risk factor, but it was an interesting find, because now we could rule out first generation as being risk factors. And so, yeah, some of those findings were expected, but some were surprising. And students appreciated the faculty support and the sense of community that they get at the small liberal arts college here. And they described their professors as being approachable and genuinely invested in the success, which most of them are, or significantly higher number of people are here at this institution from my experience. And some of them did highlight some challenges. Like one student actually said, spending even at $25 feels like a high expense for us. And I have added that quote here in the next slide. Sorry, I did not include the code, but there was a direct quote that was mentioned that even spending $25 felt like a huge expense. And that single quote tells us more than a percentage or a number could ever do. And it reminds us that, behind retention numbers are students actually making difficult financial decisions in everyday life. And of course, and after identifying these things, we examined how frequently they appeared after they appeared across discussions. Academic support and transitions emerged as the most common topic, because and that followed by financial strain, social life, and balancing athletics with academics. So this being a small liberal arts college in rural Arkansas, the majority of the students here are athletes who represent, I think, about close to 70% of the population, student population. A lot of them get admitted based on their athletic scholarships, and they're here because they want to play a certain sport. And so, yes, balancing their athletic life and the undergraduate school, because they've just come out of high school and they do not know the expectations set here in undergraduate school, or they underestimate what their workload is going to be like. It was a difficult, it is always a difficult transition for them. And there is a lot of support system that goes here with different institutions, and they are here to actually support them during their transitions. They put them in their core curriculums so that they can pick up on the coursework where they feel that they are lacking. And they also have a lot of advising and other support systems that are available. And people in general are approachable, and they have made it as much comfortable as possible for them to transition from their high school to their undergraduate program. But it was still interesting to see people see that they still find challenges, and they struggle with some of the things, and some of the things which we don't directly have control of, even though there's been a lot of scholarships that have been offered and other things. I think financial strain is one of them that causes significant stress, and that was also one of the significant theme that emerged out. And it was not surprising that financial strain uh, significantly stood out, but I think that was only as a byfactor to other things that emerged out, because I think the first things that I mentioned was academic support and transitions into their undergraduate program as being challenging, and that followed by the financial strain and the social life. Because we live here in rural Arkansas, it's not your mainstream city life. Social life is not as good. Here, you have limited resources, and it's a very small community. In Batesville, we are about 10,000 people, and so it doesn't have a very thriving social life. But on campus, there's been efforts that has been made to like have a lot of events and other things. And anyway, that was another challenging thing that emerged as theme. And so this is where the evidence becomes particularly useful, right? Because these are some things that are directly like quoted by the students. And so you know that they're challenging. And even without analysis, every issue that has been stated out here feels equally urgent, even though some of the things are not directly in control of the institutions, and maybe it's not something that we can directly take any action on. But there can be efforts that are made to improve the conditions. So data helps us prioritize which one we should focus first. So it helps us identify where interventions may have the greatest impact and where resources might be most effectively allocated. So that is a little bit of what we found with our findings with our pilot project. Now, the most important slide is the communicating evidence effectively. So this is where, you're communicating your evidence into actions. So when we collected all of these, when we conducted the focus groups, collected the evidence and like had these transcripts, that exactly was not the finish line. And even having quantitative results was not the finish line, because quantitative data allowed us to see where our focus needs to be. And qualitative data helped us understand why the focus had to be in the place that we had to, in the place where our focus had to be. Because I think your quantitative data helps you understand where some things are significantly standing out. Qualitative data helps you understand why it's significantly standing out, right? So having a mixed method approach was absolutely beneficial. But having collected all of this was not exactly the finish line. It was just the starting point, because each major finding was translated into practical recommendations. A brief report was put together to actually like have all of these findings in a summary so that it could be communicated to the administrators. And all of the academic concerns were pointed out toward mentoring and support services. The financial constraints that people highlighted were that needed for clear communications around aid and campus resources were also like directed towards those institutions. And student feedback around belonging and well-being also were kind of communicated clearly to the programming and support services. And the most important question is not what did we learn, it's what we were going to do with what we had learned. So this was still a pilot project and it was with 16 students, but the reason why I had to cap it at the sample size of 16 is because at that point of time, the statements kept repeating itself. So you've hit your sample size. You know that you're not getting any new information. So I think getting that pilot project helped us understand or get good insights into what was happening and where some things could be improved. And so this is this is something that we learned from the pilot project. And so the next step was obviously after forming the report and trying to communicate it with all the support services, with the other academic administrations as possible, and to put it clearly so that it gets effectively communicated and some changes can be seen in the future. And the one lesson that I've learned is that the evidence alone rarely creates a change. The communication creates a change. So you are dealing with a lot of different people from different sectors and different backgrounds and expertise. So communicating clearly becomes crucial, because different audiences need different messages. And here students want solutions. They came to the focus groups, they participated, they were um, they were pretty cooperative and transparent. So they wanted solutions to what they had like described as problems, and the faculty here wanted just the context to what is happening. So obviously the messaging had to be different for different people, and also like the administrators often need priorities and what actionable recommendations that I could give. So as a public health professional, I think part of our responsibility is translating those complex information into something people can understand and use. And also, yeah, good analysis matters, but I think good communication determines whether the analysis has an impact. So this pilot study kind of helped me actually turn those complex information into something that the administrations and other departments here could understand and use. And the advocacy through evidence framework and what it means to me. So working on projects like this was a project that I introduced here in this college, and it kind of reinforced several lessons for me. It The advocacy often begins with listening, and that is not something that I can stress enough. But it definitely starts with just listening to the students or anybody that you're working with, the population that you're working with. And data often provides credibility, but stories provide meaning. And I think that the reason why I wanted to like kind of put this together and present it in such a way that it actually that it actually sounds like I am describing a story from rural Arkansas is because it stands out with people, and effective communication is just as important as the rigorous analysis. Having all the statistical background and doing the statistics is important, but having been able to like communicate that clearly is crucial, because evidence is most valuable when it only helps improve people's life, and in this case, the student's life. So for me, advocacy through evidence is not about speaking louder, it's about speaking clearer and making sure the right voices are heard. And so that's some of the key takeaways from the pilot project here in the rural liberal arts college that I did. The listening is a public health skill, and having a mixed methods approach is complement to one another. And data only becomes meaningful when we have connected it to the lived experiences. That's again like just emphasizing on the qualitative and quantitative methods and emphasizing on mixed methods approach, of course. And effective communication influences decision making, because I could have done all of these analysis and I could spend a lot of months here just understanding or the slicing and dicing the data as much as possible. But if that's not communicated, and if not communicated, the results have not been communicated effectively, then there is no change or there's no improvement. And we continue to be in the same cycle of like, oh, something's wrong, but we can't figure out what, or we're not doing something about it. So I think having effective communication is really important to influence decision making. And all the small insights can lead to meaningful change. Even though this was actually a pilot study with only 16 students, it was still impactful. I think one of the other things that we did in the focus groups that I can bring up right now, which provided a lot of insight without even having a lot of, without even too much context into it, it was we did activity where it was like just giving blue and green cards to students and telling them to write what made them choose Lion, and what they made them choose this particular college, and what's challenging about this institution. And I think that simple experiment also like taught us a lot, because a lot of students, the red card was challenging part, and the green one was what made them feel belonged here, or like what brought them here. So anyway, the red and green part was like, yeah, good and bad, right? So even without like much context, or like without having to dive into the context of what they've written, the amount of text on the red cards was significantly high, like significantly larger. I mean, it was completely 2, 3 paragraphs of writing. Oh, this is what I'm struggling with. This is what is not good. But on the green paragraphs, on the green sheets, it was like, yeah, sense of community. I like my professors, and things like that. So just flipping through those cards, you could understand that, oh, okay, there are things that needs to be addressed and needs to be fixed, and it needs to be like, taken seriously, and we have to do something about it right now. So I think the focus group helped us get insights into improving student lives here. And we'll continue to keep working on different projects and, trying to develop it into a bigger research project and see what best we can do for our students, and probably keep advocating for improvement. So anyway, I think I'm just gonna leave you with one final thought. As researchers and analysts and public health professionals, we spend a lot of time thinking about numbers and data sets, reports and findings, but please remember that behind every data set is a person, and and that person has a story that needs to be heard. And this is where I'll leave the presentation, and I'll be happy to take any questions. Thank you.
Okay, well, that was wonderful. Thanks to both of you. So, Haley, if you want to come back on camera, and Nisha, if you want to come back on camera, we're going to take a few questions. So, those of you that are joining today, you can pop your questions into the chat. It's a great opportunity to get to ask questions of both of our terrific presenters. And maybe while we're getting started, what I found is usually presenters have questions for each other. So if either of you would like to ask the other a question, and then we can turn it around and then we can see what's in the Q&A.
Sure. Nisha, I guess there's some differences between our presentations, but the similarities being that this is our experience going and working in this space. What is something, from your lessons learned of doing your pilot study, what's something that you would like to take with you to future studies in public health advocacy?
I think the pilot study did help me, just understand the mixed methods approach and the challenges that it came with. Like, because I have been a quantitative person for a very long time. My first degree was in biostatistics, so for me it was all about like understanding systems through data. So the one of the things that I probably like will take away from this was, the strength of qualitative research and talking to people and listening to their stories, and how that adds meaning to what I know already about quantitative data. So think that's something that I will take away with me to my future research projects. But does that answer your question?
No, it does. It is really interesting because from the work I've done, my
Yeah.
background is so much more into qualitative, and then you're
Right.
quantitative. So we should trade experiences to kind of get that additional background. That'd be interesting.
Absolutely. No, I would definitely be very happy to do that, because I think my qualitative background has just been very recent. So, and the project that you conducted in Japan, and the whole results and everything that I saw that, you presented with your advocacy programs and other things, it genuinely sounded like something interesting work to like explore. And I'd definitely be open to like, learning more about your work.
Thank you. You as well.
All right, and Nisha, do you have a question for Haley?
Not particularly. I'm still trying to learn more about her research and other things, because it is interesting. And at the beginning I've kind of missed a little bit because I was trying to struggle with my slides. So I'll get back to you, Haley, I promise.
Sure. I will just say that like I said, there are differences, you know, and what you said about, behind your data sets, there's people and the people have stories. From I think you said your 16 people, 16-person data set.
Yeah.
Those are 16 people. You can get their individual stories from the work I did. It's on this global scale. It's almost, unimaginable how, thinking about how there's so many different people in the world, and then your target audience, how do they all feel? It's a really different kind of perspective that you go into, because you think like, oh, I'm a qualitative, observe, like, I do qualitative analysis. I should look at everything. I should look at everybody's information. If I did that, my brain would would have
Yeah.
trouble. So it is really interesting, the global health space and the public health space, and how we tackle that, how we still make sure those voices are heard and matter, which I find really interesting.
Yeah, absolutely. I know my work here, I mean, since it's a small liberal arts college, it's the sample size of 700 students. So it doesn't seem so big, but at the same time, I see the parallels of like having connected it to the global scale and how you still like, get the representative sample. Yeah, that sounds interesting. And I don't know exactly what the selection strategy that is used for that kind of qualitative methods, but I think that is one of the things that I would be really interested in learning from you, because that sounds like a lot of work, but also it sounds very interesting.
And Nisha, we've got a question in the chat. Looks like it's directed to you. It says, we're getting ready to start key informant interviews and focus groups as part of our evaluation strategy for making tobacco cessation and lung cancer screening more accessible for people with disabilities. We hope to do this both pre and post implementation. So Nisha, the question is, what is something you wish you had thought of before you started your pilot study? So it's key informant interviews and focus groups as part of their evaluation strategy.
Okay, key information. Well, I think because this is the first pilot study that I launched, the one thing that I really wish I thought of before was um, more focus on training the facilitators, because we did have a training, but the thing is it was brief training before the session. So having a particular day set for training the facilitators, because sometimes what happens is, from my experience of like the focus groups, the study got a little derailed with the conversation itself, because we want it to be informal too. We want the participants to feel easy and be able to connect with the facilitators and give and talk to them freely. But at the same time, we don't want to lose our focus. We want to still keep it to the points that we want to collect data so that we can actually make actionable um, decisions based on that. So I think high priority on facilitator trainings, and also just having separate study groups in different places so the voices don't like overlap with each other. Um, and also like trying to evaluate if this is a small study with small number of people, which I don't think it will be if this is a tobacco cessation and lung cancer screening. Think that I don't know what the sample size is, but if the sample size is small, I would also like advocate for one-on-one interviews rather than doing a focus group, because with 16 people, it was not really ideal to do one-on-one interviews. So we did focus groups, but doing one-on-one interviews is more has its own strengths too, because what happens with the focus groups is one person talks and then the other feels, they feel like they should build off of that instead of like forming their own opinion or like going by their opinion. So those are some of the challenges that I've noticed, and uh, I wish I knew before I started this process, but I hope that's helpful for your study. It sounds really interesting.
That was terrific. Yeah. All right. Okay. Well, that was fantastic. We are going to record this, so we'll get it up on our website very soon. So thank you very much to all of you who joined. Double thank you to our presenters. Really enjoyed these presentations. And I hope all of you can come back and join us for our next webinar on July 17th, 2 p.m. on rural health communications. All right, and that concludes today's webinar, and we will see you all soon. Thanks so much.
Thank you so much.
Thank you so much. Bye.